Hi everyone, I'm Ruby, one of the podiatrists here at the Foot Care Clinic. Today I'm going to be talking to you about different joint conditions that can affect the feet. So earlier this week I had a patient present to the clinic for their first appointment, and straight away when I saw him I could tell he was in a lot of pain. He could hardly walk from the waiting room to the treatment room. And then when I got talking to him, he was telling me that he's been getting a lot of pain around his right first and second toes. He said the pain started randomly about 3 weeks ago, didn't recall any injury or trauma to the foot, but it's gradually got really worse over the last week. So then when I got him to take his shoes and socks off so I could have a bit of a look and start doing a few assessments on the foot, I could tell, pretty much straight away that there was something going on that we needed to look further into. So the toe around that first and second toe looked very, very swollen. It was very hot to touch and extremely red. Like I couldn't even move the toe in the slightest degrees or even touch it without causing a lot of pain. So we then discussed a range of different diagnoses of what could be going on in the area, and I decided it was best to send this patient off for further testing to have an X-ray and ultrasound done so we could see exactly what structures we're dealing with. I also taped the foot up during the appointment and put some padding under that area that was quite sore just to provide a bit of comfort for that day. Then when I checked the X-ray and ultrasound results a couple of days later, it suggested that there was synovitis within the right first and second MTPJ joints, so they're just the joints around the toes. And synovitis is basically inflammation of the tissues that line the joints, but is often associated with a different type of disease such as rheumatoid arthritis or gout. So I've since referred this patient on to a rheumatologist for extra testing again. So basically I guess what we're saying is there's so many different conditions that can affect that area of the foot, and often we do need to do further testing to rule out things like fractures or joint conditions, soft tissue, bone, any of that sort of things. We can just have a bit more of a look. So if you or anyone you know is suffering with joint pain, basically at the clinic here we take a thorough history, do a thorough assessment here, and then if we feel you need further testing we will let you know, and then we try and work out the best treatment options so you can live a pain-free life. So if you have any other questions, let us know. Thank you.